Hi, it's Mark Chris from Sloan Kettering. I've been asked by the folks at Medscape as the end of 2022 approaches to make kind of a wish list for things that would be important to care, to patients, and to our practices and institutions. We've been through a lot in these last few years. We've been through COVID and still are in it, monkeypox, RSV, and now what appears to be a raging flu epidemic, and a lot of things have changed. And I think the two things I would wish for the most would be to grow out of these crises, as they were, to focus on two things. One is communication, and I think the other is innovation. I think we've seen everywhere a huge fall off in our ability to communicate among the members of the healthcare system and with our patients. I can think of personal experience after experience where I have tried to reach a fellow physician to discuss a patient. I've tried to reach a pharmacy, and for all kinds of reasons, the communication was just not possible. The second part of it is, even when you can find a way to communicate, we've had a loss of the human contact, the human part of communication. And if I could wish for something, it's that we find better ways to communicate with all members of the healthcare team, and with our patients, and find some way to inject humanity back into our daily actions. I'm sorry, a text message or an email, it's just not the same as a phone call, and clearly also not the same as having a visit. I think the other wish for our institutions, I'll call it for innovation. And I do think that the various demics have opened up some opportunities for us if we would just take some of those lessons and take them forward. I think one thing is for the value of immunization. I'm just absolutely struck how since the availability of immunizations against COVID, I've not had a single patient succumb to the illness despite having a practice of patients virtually completely those with metastatic lung cancer. The vaccines have made a huge difference, and it's shown the power of vaccines in preventing really serious injury and death. A challenge that we need to overcome is to somehow find the balance between video and audio and in-person visits. I think both have their place. They can make life a lot easier, but we need to find just, let's say, how many visits we would need, the timing of a visit, and make sure it's being done face-to-face at a crucial time in someone's care. We need to find a way to use the power of the ability to have a telemedicine visit, which we really didn't have before, to make sure that we use them wisely, that we have face-to-face visits when we need them. The other issue is a appreciation of the role of caregivers and family. I had an experience this weekend. My brother-in-law, Kevin, was hospitalized last Friday morning. And I got the word. I went to the hospital's emergency room, and I walked into the lobby, and the guard came to me, and I thought he was going to give me a mask. And he said, "No, you have to leave." He said, "You can only communicate with my sister, my brother-in-law, and the healthcare staff via telephone." I wasn't even allowed to go into the lobby, to go into your car, he told me. Later that day, my brother-in-law was transferred to a rehab facility, and they found a way. There was an automated way to check in and ask the COVID questions, and there was a huge box of COVID tests. And all they asked is that you gave yourself a COVID test, filled out the standard questionnaire, and you walked right in. Any number of visitors that needed to be there. So it was one healthcare facility that just kind of hadn't thought things through, particularly when people are at a time of crisis. They need their family, they need their caregivers there. And you just got to find a suggestion. Obviously, you have to protect your staff, you have to protect the other patients, you have to make sure people are COVID and infection free. And there are ways of doing that, but you just can't have these blanket solutions. You're not allowed here, go sit in your car. It's absolutely crazy. But again, that bad experience was juxtaposed by a different experience with a more thoughtful group of people. And the last thing is we need people in research to think about alternate ways of care for two things. One is rare diseases, and another is for research, particularly for rare diseases. You know, a lot of the standard rules were broken for clinical trials during COVID. People didn't have to be there for every visit. People were able to ship drugs to other sites where formerly you had to come to the institution to get the drug. People found a way. And using that same kind of opportunity going forward could be a way of getting specialized care to more people and getting clinical trials, frankly, to more people. Now, it's an unbelievably difficult problem to solve. The first is our partners that are developing these drugs have a huge amount of standard operating procedure. And they are always afraid that if they violate their standard operating procedure, the regulators that they must answer to will and somehow penalize them for violating their procedures. So what we need is understanding by the sponsors of clinical trials, by regulators, that things are different and we can do a much better job with clinical trials. We did that during COVID. I don't think we cut down on the number of people we treated, but I don't think those people were mistreated. The last thing we need to do also is to rethink our licensing. The last time I looked, 40 states, including my own in New York, required a license for me to have a telemedicine visit with somebody in my state. So we need to somehow think different procedures that will allow docs to have licenses. I know the state of Florida had a very simple process to get a permission to do telemedicine visits of patients in Florida. That was very easy to do and took away that problem for a lot of my patients that winter in Florida. And I think other states need to follow that lead. So lots to do, lots of opportunity. I think we've come through a really tough time, but we learned some lessons that can help us go forward. And when this is all said and done, we're going to be better doctors. We're going to be able to better serve our patients, and our institutions will be able to better serve both our patients and all our hospital staff.